Welcome to our channel. In today's video, we will be discussing a very important anti-diabetic medicine known as Getryl 4 million tablet. This tablet contains the active ingredient glimepiride, which belongs to a group of medicines called sulfonylureas. It is commonly prescribed to patients with type 2 diabetes mellitus. Let us first understand how Getryl 4 milligram tablet works. In type 2 diabetes, the body does not produce enough insulin or the cells become resistant to insulin. As a result, blood sugar levels rise. Getryl 4 milligrams works by stimulating the pancreas to release more insulin. The increased insulin helps lower blood sugar and allows glucose to enter the body cells for energy. Now let's move to the uses of Getryl 4 milligrams tablet. Doctors prescribe this medicine for type 2 diabetes mellitus to control high blood sugar when diet and exercise alone are not enough. It may be prescribed along with other anti-diabetic medicines like metformin or insulin for better sugar control. It helps in reducing the long-term complications of diabetes such as kidney damage, eye problems, nerve damage, and heart disease. The dosage of Getryl 4 mg tablet depends on the patient's age, blood sugar levels, and medical history. Usually, the doctor starts with a low dose and gradually increases it depending on the blood sugar response. The tablet is taken once daily with breakfast or the first main meal of the day. It must be swallowed whole with water, never chewed or crushed. Let's talk about the benefits of Getryl 4 milligram tablet. It effectively reduces blood sugar levels. It helps prevent diabetes-related complications. It works well in combination with diet and exercise. It is convenient as it is usually taken once a day. It allows better utilization of sugar by body cells, which increases energy levels. But like all medicines, Getryl 4 milligrams can also cause some side effects. The most common side effect is hypoglycemia, which means very low blood sugar. Symptoms of hypoglycemia include sweating, shaking, fast heartbeat, hunger, dizziness, blurred vision. If any of these occur, the patient should immediately eat or drink something sweet like sugar water, juice, or candy. Other side effects include nausea, headache, weight gain, mild stomach upset. In rare cases, Getryl may cause severe allergic reactions, liver problems, skin rash. Now let's move to precautions. Getryl is not for type 1 diabetes or diabetic ketoacidosis. It must be used with caution in patients with kidney or liver disease. Alcohol should be avoided as it can increase the risk of low blood sugar. Regular monitoring of blood sugar levels is essential while taking this medicine. Pregnant and breastfeeding women should consult their doctor before using this medicine. Patients should not skip meals while on Getryl as it increases the risk of hypoglycemia. To summarize, Getryl 4 ml tablet glimepiride is a highly effective anti-diabetic medicine used in the management of type 2 diabetes. It lowers blood sugar, reduces complications, and improves quality of life. However, it must be taken carefully with proper diet, exercise, and regular follow-up with the doctor. If you found this video helpful, don't forget to like, share, and subscribe to our channel for more detailed videos on medicines and healthcare.